Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blaiklock, and boy, it's that time of year where we have a cough, a sneeze, a wheeze, and the symptoms go on and on. Is it the cold or flu? What should we do? And today we have Dr. Amanda Chism, who actually specializes in internal medicine and pediatrics to help us through that maze of symptoms. So thank you for being here with us today.
Of course. I'm happy to be here.
Let's start a little bit about maybe deciphering between what the signs and symptoms are between the cold and the flu. What makes it different?
Sure. Well, it can be really difficult to determine, and sometimes we as healthcare providers really have trouble figuring it out as well. The flu is a virus just like the common cold is a virus, and so that's why these things all look the same. Symptoms that are common to both would be a sore throat, a cough, a runny nose. Those are all very common with both. Probably the way that I'm able to distinguish it the most is with the flu you can get very high fevers, and so some common colds can do that too, but often you don't have a high fever with the common cold. And by high fever, what I'm really talking about is something above about 101 or so that really is starting to make you feel bad. And then the other thing that the flu often does that other viruses sometimes don't do is gives you muscle aches and pains. And so if you're really getting joint aches, muscle aches, where you just feel so sick, so down that you can't hardly move, that's often the flu as well. Sometimes, but not quite as frequently, you can get kind of stomach pain, diarrhea, that kind of a thing. That's a little more common in children, and that would be something that the flu sometimes does, but not often, but the common cold does more frequently. Sometimes you'll even hear people say something like the stomach flu. Well, that's actually really not truly the flu. That's a separate virus that causes more of a stomach infection.
Very good points. Now, I think we hear the body aches, and that usually tends to be one of the common, I guess, distinguishing factors between the two. And also sometimes people say they feel like they've been hit by a train and it comes on really fast. So which one is that, the cold or the flu?
So the body aches is the flu, and feeling like they've been run down, that's the flu rather than the common cold. I talked to my medical assistants in the office. It's actually, a lot of times we have trouble distinguishing, like I said, so we have to run the flu swab. So we'll say, well, do you think this person has it or not? And if they're really down and they just can't hardly move and they come in and they feel like they've been hit by the truck, that's the one where I'll tell my medical assistant, I bet they have the flu, because they just feel so bad that they just can't hardly move.
You're right, and I think generally that's where the people are feeling so weak and they just can't get out of bed and function. So, boy, that's unfortunate.
Yes.
So I guess who is at risk for the flu?
Well, anybody's at risk. You get the flu by droplets that are in the air. And so if anybody coughs, sneezes, even by talking, if you're in close enough proximity, you can get the flu virus. And so that's why anyone's at risk. There have also been a few studies that have shown, for example, if you were to cough into your hand and then touch a doorknob or something like that, and then somebody comes along and touches that same doorknob and then they touch their face, they could contract it that way. So anybody can get it through those mechanisms. But people that are a little bit higher risk are the very young, so babies, children, younger children, and then also the elderly. And so anybody over about the age of 65 often has a lot more trouble whenever they develop the flu. Anybody that has an autoimmune disease or any type of immune system disease has a little bit more trouble fighting the flu if they get it. Pregnant ladies are at much higher risk as well. And then also anybody that has a liver, kidney, heart issue, lung issue, that has a little bit more trouble at baseline that isn't quite as healthy at baseline. So for example, people with COPD, people with diabetes, people with heart failure, all of those people are at a little bit higher risk if they get the flu. And what I mean by higher risk is just that if those people get the flu, they're more likely to end up with a pneumonia or be hospitalized for it, end up with more severe complications.
All right, so you've hit on a couple of good points there. And tell us a little bit about how long it takes, maybe that incubation period. So if I've been exposed to that individual or unfortunately maybe touched something that somebody has just touched, what is that general time frame there?
Well, it's actually different depending on different people, but often it's about 2 days or so, but it can be as long as about a week to 2 weeks even. And so it's really tough to give you an exact time frame, but usually you're most infectious within that first few days, those first 2 or 3 days. And so if you pick up those germs, you can carry them for a few days before you really show symptoms.
And that's unfortunate. So
Yes.
what can we do
Yes.
as far as protection for those of us that are trying to stay healthy during the flu season? What should we do?
Of course, number one is wash your hands. That's what we always talk about as physicians. Right before you eat, anytime you have used the bathroom, anything like that, always wash your hands very well. Whenever we talk about washing your hands, I even go so far as to say be sure that you get your thumbs involved all the way up to your wrist, wash the back of your hands. It's amazing when you think about it how a lot of us just kind of throw our hands under the water and then we're done, but really taking the time. Some people say you can sing the happy birthday song or something like that to really do a good job with that. And then of course teaching your children the importance of that too. The other thing that is a little bit newer that I didn't hear until I started my medical training was teaching people to cough into their elbow. So we used to say cough into your hand, but then as I described earlier, you cough into your hand, then you touch a doorknob or something like that. So if you teach someone to cough into their elbow, that's kind of a safer place where they may not be able to kind of get their germs elsewhere by something like that. And so the other thing that I usually say is if you do use a Kleenex or a tissue to cough or sneeze, try to wipe your hands right after that, especially if you're in a public place. Hand sanitizer has been a great development to help us with something like that, because if you are in a place where there's no soap or water, you can always use hand sanitizer. So if I am sick in the office, or you know, I try not to be sick in the office, but if I'm sick and then I'm somewhere where I could potentially be around other people, then whenever I cough or sneeze into my hand, I always just grab the hand sanitizer and use it right away.
Good point. So tell us a little bit about the flu shot and who actually should get the flu shot.
Okay, that's a great question. A lot of people that I see are actually very nervous about getting the flu shot because they've heard a lot of rumors or misinformation about it. So the most important thing to know that it is a recommendation for everyone to get it, because it does help prevent you from the flu, of course. And so the people that should get it the most are that young category, and then the older people that we mentioned, and then all of the other people, pregnant ladies, the people with all of the other disease processes, so COPD, diabetes, all of that.
Now, a lot of people think they can get the flu from the flu shot. Is that a myth?
Definitely a myth. It's something that I do hear a lot in the office. So the important thing to know why it's a myth, or for me to explain how it's a myth, is to understand how the flu vaccine is developed. And so the way that they make the flu vaccine is they actually take the flu virus and deactivate it. So it's a killed virus. So there should be no way that it can get into your body to actually cause the flu. The way that it works is they take the deactivated virus and we inject that into your body, and then your body develops antibodies against that virus. And so that's how it helps protect you from the flu, because those antibodies will be in your body if you ever get exposed to the flu. So those antibodies will then work to protect your body against the flu.
So they're kind of recognizing it, saying, hey, wait a minute, already been exposed,
Yes.
I'm good to go.
Yes.
Unfortunately, some seasons, and from what I understand, they try to anticipate what's going to be coming in the next season. And there can be times when it can be either misjudged, or from what I'm understanding, maybe a genetic mutation can even happen too with the strains. And maybe you can help explain to our viewers that it's not one virus. There are many viruses that make up the flu too. So help us understand that a little bit.
So actually a lot of people say, well, how come I only have to get the chickenpox shot once or twice, but I have to get flu every single year? Well, the reason is because those other viruses, they stay the same. They never change. And once you get the antibodies, you're good forever. Flu is different. Flu actually lives in humans, it lives in pigs, and it lives in birds. And so the way that the mutations occur is that the virus that's in you, or that affects humans, meets these other viruses, and when they see each other, they swap genetic information. And so what that means is that the virus is changing on a yearly basis whenever it sees the virus in these other animals. So for example, a pig can have the human virus and the virus that affects pigs, and then it can change, and then it comes back out into the human world and we get a different virus. And so that's actually why it changes. And so the CDC and the organizations that develop the flu shot every year, they have a tough task ahead of them. They have to predict, well, what is it going to change to? What is it going to mutate to? And so that's how they develop that strain of how are we going to protect people this year? What do we think it's going to look like? And often they do a very good job with this, and it's very protective, but every now and then it is a little bit off from the disease that actually comes out that starts infecting people.
And we can see, I think, over the years, trends where you have a flu season where it's not very active, and sometimes it is more active, and that can be maybe caused due to the genetic mutations, also the exposure, et cetera, et cetera.
Right.
So what we need to do is, I heard you say, is wash our hands.
Yes.
Make sure if we are do get the flu, we need to stay home.
Yes, absolutely.
How long are we contagious?
Well, another good question that's difficult to answer. So you can actually be contagious for quite a while. Some people have even been shown to spread the virus for weeks to even a month or so after they get the flu. But you're most contagious in that first 3 to 7 day window. And so what I usually tell my patients is stay home at least until you don't have the fever anymore. Usually whenever you have the fever, you're more contagious. So I say stay home until at least the fever is gone for 24 hours. After that point, you still may be contagious, but less so. So as long as you do things like cough into your elbow, like we talked about earlier, wash your hands really well, particularly after you sneeze, then you're going to protect other people from getting it, even if you're infectious.
Right. That's, I think, a very good rule of thumb, that breaking the fever, staying home. You said 24 hours,
Yes.
Is that right? Until they return to work or school, et cetera, to help lessen the spread, and also to get that person feeling better, to where they have their strength back. Now, what can they do as far as treatment? Should they seek that medical treatment from their healthcare provider, and why is it so important to establish that relationship with that healthcare provider?
Right. Well, so absolutely we do have a treatment for the flu now. They developed initially 2 ways to treat the flu. One of them, the flu virus has already mutated enough that it doesn't work as well as it used to already that quickly. The other one works pretty well, and so Tamiflu is the thing that you hear people talk about getting when they get the flu shot. It works fairly well to help relieve some of your symptoms. It really only works, it works the best if you get it within the first 2 days of your symptoms. And so if you think you're coming down with the flu, if you think that there's been an exposure to the flu and you might be starting to get the symptoms, the medicine will be most effective if you go to see your healthcare provider in that first 24 to 48 hours after you get the flu. You can still take it after that, it just doesn't work as well. The way that it works to help you feel better is it helps to reduce your symptoms as well as decrease your course of illness. And so the studies that they've done on the medication we use for flu is it shortens your course of illness by about a day or so. But often, in my experience with patients that have taken it, they just feel a little bit better on it. They feel like it does help them to feel a little bit better. And
so it's not an antibiotic.
It's not.
I think we need to stress that. It's more of an antiviral to help them feel better, correct?
Yes, absolutely. And it's one of the only antivirals that we have. There are a few antivirals, but for common colds and for things that we give out in the doctor's office, it's tough. You know, with bacterial illnesses, we have a lot of antibiotics that we use. And there are several antivirals for some things, but as we mentioned before, the common cold and flu are very similar, and for most common cold viruses, we don't have anything that we can give you that fixes you, that makes you better. The flu is an exception, and that's why it's important if you think you have the flu to go see your doctor, because they can give you something to help you feel better.
Sounds good. So that's not the end all, because of course they'll need to maybe get that Tamiflu.
Yes.
They need to rest. What
Yes.
else do they need to do as far as maybe treating some of the signs and the symptoms generally?
Absolutely. So definitely rest. That's one of the most important things. Drink plenty of fluids, because often they don't feel like they can eat, but your body definitely needs nourishment and nutrition to be able to feel better. So as much fluids as you can. And then I like to do some scheduled ibuprofen with my patients, as long as there's not a contraindication to ibuprofen. So you can't do that if you have stomach ulcers or if you have kidney problems, but if you're pretty healthy, ibuprofen does help you to feel quite a bit better. And you can take quite a bit more than the over-the-counter recommendations, so people should talk to their healthcare providers about exactly how much to take. And then everything else I do is just based on their symptoms. So if they have a lot of runny nose, I like to use a decongestant with that. If they have a lot of stomach problems, there's some medicines that we can give to help with nausea and things like that.
So as a healthcare provider for pediatrics and internal medicine, I'm sure you're seeing families.
Yes.
And it might travel through the house,
yes,
correct?
Absolutely, it often does.
So they need to probably do some disinfecting too, correct?
Yes, definitely. So I usually tell people if they can to try to stay away. So if it's a brother-sister thing, try to keep them away from each other as much as possible, which is very difficult sometimes. And then still just the good hand hygiene. Use any disinfectant in the house. Try to keep this sick person confined to 1 or 2 places in the house so that they're not spreading it all over the house.
So as a healthcare provider, and we talked about just a minute ago seeing families, which is very important to establish that relationship, to kind of have that continuity of care through their lifetime.
Right.
What should they do in looking for a healthcare provider, and when is it too early to have a healthcare provider, or is it
It's
ever?
never too early, of course it's never too early. So the things that I've seen that are kind of changes in medicine over the past few years is now we have a lot of little clinics and pharmacies that are giving vaccinations and things like that. That is all wonderful, amazing. It definitely helps you to feel better. I think it's wonderful that you can go to get vaccines places where you couldn't before, because it's easier sometimes on your pocketbook, and then also for your time as well. The important thing to remember is what you want to find for you and your family is a medical home. And so what that means is a doctor that you can go to that knows you, that knows your relatives, that is able to say, okay, what do I think is going on with you today? Knowing that, oh, your mom has this issue going on, or your child has this issue, that sort of a thing. So if you do utilize some of those other places, like a Walgreens to get your flu shot, or a little clinic to get a head cold treated, anything like that, what you want to do is try to find your primary care provider and get all of those records to that person so they still know what's going on with you. And it's really important to have that person just for your own well care. And so a lot of people, particularly I see people from about the ages of 18 to maybe 33 or so, that don't have a healthcare provider. And so the reason is because they get old enough to where their pediatrician doesn't see them anymore, and they're usually very healthy people. But the reason that it's important, even at that age, to go in to be seen is for any screening, preventions, vaccinations. So in that age group in particular, some of the things that I think get missed is cholesterol screening, particularly if they've had family members or people that are older than them that have had heart attacks or strokes early on in life. Those people definitely should be screened for that, as well as flu vaccination, tetanus vaccinations. There's the new recommendation now with the tetanus vaccination that you want to be sure, particularly if you're going to be having children, which often people in their 20s are having babies, they should get that whooping cough to protect their children. Whooping cough is something that parents often are okay with. It's just a little bit of a cold, but if a baby gets it, they can have trouble breathing and things like that. So those are the things that if you sit down with your healthcare provider, they should be able to walk you through and say, okay, these are the things that you need at this time to help make you as healthy as you can be. And so our goal is to promote health and as well as treat illness. But you know, if we can promote health and keep you healthy on the front end, then you're much less likely to have these issues with illness on the back end.
And I think you just totally summed it up. And I think that's exactly where we hope that everybody's going to go. What happened, those traditionally everybody thought they needed to go to the doctor just when they were ill.
Right.
And that's not the case.
Right.
You know, we can prevent so much if we get you in the door to make sure we're taking care of you for your lifetime and keeping you well and doing a lot of the prevention type tips. So
there's been a lot of if you look at the studies, the rates of breast cancer and colon cancer and things like that, if you actually get these screenings and see your doctors and get these screenings when they tell you to, the rates of those things are going down because we're trying to get to them earlier and sooner before you really have problems with it. And so that's why it's really important to try to find that one person who's going to be your primary care provider and discuss all of your health issues with them or concerns. And even if you're healthy, say, okay, well, what do I need to do to stay healthy?
You're kind of writing your own health and wellness storybook, really, and establishing that relationship with your provider. And it truly is a relationship because they need to know you when you're well. If you have those acute illnesses such as the cold or the flu, unfortunately, and you're trying to prevent some chronic things down the road. And the only way you're going to know that is by your personal history, your family history, and have you had everything that you need. So very important to get that medical home and establish that early, and not ever too early. And that's why you have pediatrics starting on up so that you can take care of those individuals.
Yeah, I chose internal medicine and pediatrics. It's actually kind of 2 degrees basically. So I did a residency in pediatrics and a residency in internal medicine, which treats adults. And my favorite part of my job is that whenever I see, you know, an 8-year-old, I also sometimes know their mom's health history, and I see their mom, and then I also see their grandma. And it's just so much fun to be able to kind of connect all of their issues and concerns.
And put it together for the best care for them.
Exactly.
Because everyone is different, and every person's going to be treated a little bit differently based upon their family history, their personal history, and what's going on. So very important to establish that relationship. And I think you made some very good points about making sure that they get in for those well checks and the flu shots and the different things that they need to, so that they're taking care of themselves.
Yes, I think what you said is absolutely true. And it's always interesting to me that people are really good about bringing their children to the doctor for their well visits. Parents are wonderful about saying, oh, we're 4 years old, we got to go in, we got to get these vaccines, we got to do the checks, we got to be sure we're growing right and doing all that. And then it's that transition when the child starts taking care of themselves that often it drops off. And so we're always so much better about taking care of other people than we are of ourselves. And so it's really important for everybody to remember that it is important to care for yourself and to get all of that screening so that you can be the healthiest person that you can be.
Absolutely. Best quality of life if you can take care of your health, right? That's true. Well, we appreciate you being here with us today, and especially sharing some of the dispelling, I guess I should say, some of the myths, and also helping us through the maze of the cold and the flu, and also the importance of establishing a relationship with a primary care provider and establishing that medical home, and really, as we were talking about, writing your own story for your own health and well-being. For more information, we invite you to go to www.hmh.net. We have a list of service providers through Hardin Memorial Health, and also there's information on there with resources for your health and well-being. We hope you tune in next month for another important edition of Health in the Heartland.